on this computer. Recording in progress. Right, so welcome to Liz.
Hello,
Liz,
nice to be here. Thank you for inviting me.
thank you. So Liz is going to talk for us around vision and eye health. Just the same as the first session, if anybody's got any questions, please just shout up, because we might not be able to see your hand when we share the screen, okay? And if we could all go on mute while Liz is speaking, just so there's no background noise. Liz, if it's okay, I'll leave my sound on like I did in the first session, just in case there's any technical difficulties or anything, or I don't know what I'm doing and I can't get back on. So I need to talk to you. Okay, so is everybody all right if we start? Great, let's share the screen. Can everybody see Liz's presentation? Great. Right, go for it, Liz.
Right, well, hello everyone. My name's Liz. Not many people call me Elizabeth. I'm a committee member of the Northumberland-Tyne and Wear Local Optometric Committee. So if we go on to the next slide, I'd explain a little bit. So the Local Optometric Committee is basically committees formed of optometrists or opticians that test eyes and provide services for the NHS. Normally on the high street, sometimes in out of town shopping centres. So I actually don't work in practice in Sunderland, because the LOC that I'm part of covers quite a large area. So I tend to work mainly in Northumberland or Gateshead. So the talk I'm giving today is not particularly about Sunderland, it's about eye services in the whole region. Okay.
There's lots of quite difficult words to understand. So if anybody doesn't understand them, please come off mute and ask what it is, and I'm sure Liz will be kind enough to explain to us. Okay.
So, what do the LOCs do? The Local Optometric Committee, the committees I'm on. Well, to be on the committee, you have to be a person that tests eyes, like an optician, or another word for that is optometrist. We test eyes, as most of you have all had an eye test, at least, well, hopefully, lots of eye tests, but hopefully everyone will know what I'm talking about when I say a sight test. So there's often a lot of them, as you know, are independent businesses. Some of them are large chains. So so the idea of the LOCs was to coordinate all the services, and also a lot of NHS services are carried out in opticians' practices. A lot of sight tests are done under the NHS if you're entitled to an NHS sight test, and there's a lot of other services as well. So the LOCs try and keep the opticians or optometrists informed of what NHS services they can be providing. So we sort of negotiate with local NHS England teams, and also involved in the setting up of extended primary care services. So what I'll explain all this a little bit more. So as you know, having a sight test in England is quite regulated, and there's a set things that have to be done as part of the sight test. That includes testing your eyes for new glasses, checking the health of your eye, and those are the main things that have to be done. So, and that's covered by the NHS sight test. But more and more optometrists and opticians are getting involved in services beyond that, to do with monitoring eyes, or perhaps referring you to the hospital for cataract surgery, or perhaps checking the pressure in your eye. And this is going to be happening more and more as in the future, because more and more of us are living with long-term eye conditions. So the government have a plan at the moment that, I don't know if some of you may have heard, it's called the Ophthalmology Transformation Programme. And what the aim of that is to transfer some monitoring of long-term conditions that are currently done in the hospital to be done in local opticians' practices. Now, I know for some people this seems like, a little bit scary, because they're used to going to the hospital, and it won't be very many things, but just some things the plan is not at the moment, but that is the plan for the future. So it's important that these will be the opticians and optometrists who are involved in this sort of thing will have special training, and they'll have to pass special tests to make sure that they can do the extra tests if necessary. And again, the LOC will be involved in setting up these programs, because they will be part of the NHS, and they'll be no one will be paying for them, but the LOC will be involved in negotiating with NHS England to set up these new services, which we hope will appear in the future. I'm going to talk more about that on a later slide, but this is just as an overview to say, what the LOCs do. So now I'm going to talk. That was just introducing myself and who I'm representing, really. So for the rest of the talk, I'm going to talk a little bit about. I'll say a little bit more about the extended services. I'm going to talk a little bit about just the normal eye test and why you should have an eye test, and then I'm going to talk about vision and how you can keep your eyes healthy. Well, obviously, it's not everything is in your control, but the things that you can do, and also talk a little bit about the vision and falls and things like that. So I'll just finish this. What I might do is finish this little bit about extended services, and then I'll take questions before I go on to the next topic. So the sort of things that may happen in the future or in the next few years in local opticians rather than in the hospital will be having your intraocular pressure, or IOP, or eye pressure, checked again before being referred to the hospital. Because sometimes if you go to the optician now and you have an eye test and they say, oh, your pressure's very high, we're going to refer you to the hospital. And then you get to the hospital and then say, oh, your pressure's fine, you can, we've discharged you. So there's plans being set up, and not immediately, but it will happen with there'll be you might have your pressure checked again in your local opticians. Checking your eyes after cataract surgery. At the moment, I think you just go and have your eyes tested by your optician after cataract surgery. But in the future, they might actually have you, to check there's the full check there, checking that your eyes settle down and checking your vision. And then another thing, low vision assessments, which means, and supplying of magnifiers, which is supporting people with low vision by giving them aids and referring them to other agencies. This sort of thing's all done under the hospital at the moment, but what is likely to be done in the future in local opticians' practices. So I think that's the last. Has anyone got any questions on this topic before we move on to the next mini topic?
Can I just clarify, when you talk about intraocular pressure, is that when you go to the opticians and they do a little puff of air in your eye?
Yeah, well, that's the puff of air is the main way that are testing your intraocular pressure, but there are other ways of testing it as well. Right. So in the hospital, they numb your eye and use a technique which actually touches your eye. So, and some opticians do this as well. There are other ways. There's a little there's something called an eye care, where you can touch your eye with a little probe, and that's another way of testing your pressure. But yes, that's right. On the whole, it tends to be a little puff of air test, which sometimes is very good as a screening test. So it will tell you if the pressure's high or if it's low, or if it's normal, but it's not as accurate as some of the other tests that they do in the hospital.
Okay, I think that would be the thing that most of us know, isn't it, when we've been for an eye test? Yeah. That little puff of air. Audrey, did you want to ask a question? Audrey Polkingham.
Yes. I would just like to know, is she saying that if a patient has glaucoma and they end up with laser treatment, will all the follow-up procedures be transferred to a local optician centre like the now where you get your glasses, I think, is where they're doing some of the tests, or even superstores, you know what I mean? So does she mean does she mean just for checkups initially, or if you've had treatment, like I had laser treatment because I had right angular glaucoma, and I get checked on a yearly basis, will that be transferred to another outlet? Is that what you're saying?
No, there are no plans at the moment in Sunderland to transfer any of the services out of the hospital. But,
Right.
In other areas, then already there are some services being set up, and checking intraocular pressure is one of them, but not after laser. More often, before you get referred into the hospital, your pressure might be checked more than once before you get referred in. I think that's quite a common. So
not like a follow-up when you've had surgery.
Not. I don't think that after. I mean, as I say, this is the plan. The big picture plan is going forward in the next 10, 20, 50 years. That,
oh God, right.
Yeah, because with so many of us are living with chronic conditions, that that more routine tests might be done in the community. So this is there's nothing definite planned at the moment, and of course the NHS will cover these things whether they're done in hospital or in the community, so no one will pay for them. So there's no plans at the moment, but that in Sunderland, I say in some places there already are opticians carrying out some tests, but I don't think anyone would be. I think after laser treatment, I would think you'd always have to be seen in the hospital at least once in a few years. Yes, yeah.
Right. Okay. Anybody else got a question? Otherwise, I'll share my screen again. Great. Okay.
Right. So, can we go back to the previous one? Yeah. So I'm going to talk now just about the general sight test, which you're all probably more familiar with this, because everybody, whether they have a problem with their eyes or their vision or not, should have a sight test at least every 2 years. And for a lot of people, this is available on the NHS. I mean, if certainly for everybody over 60, anyone on universal credit, anyone with diabetes or glaucoma, and for children. And so why, a lot of people, often it's been difficult for people, especially during the lockdown and the pandemic. People have tried to limit the amount of times they go out of the house, quite rightly. So a lot of people have put off their sight tests, and that's perfectly understandable. But now, so why should you have a sight test? Well, so sight test, you might think that you're seeing well, but you might not, especially if your vision deteriorates very slowly, you might not notice that it has. So if you suddenly don't see very well, then you notice that. But if it's a gradual deterioration, you may not know. And so it's important that you do have your eyesight checked, and so that if you do need new glasses to make it more clearer or more comfortable to see, then that will improve the quality of your life. You'll see the television better. You'll be a safer driver if you drive. So you'll be able to see your photographs more clearly. So that's one reason why, even if you don't feel there's a problem with your vision, it is a good idea to go and have your eyes tested. As often as your optometrist will, use the word optometrist, it's the same as an optician. So perhaps I'll use the word optician, it's a more familiar word. But I do mean someone who's actually qualified to test eyes, rather than an old-fashioned optician would just supply glasses. But I use the word optician. So the optician would advise you how often you need to have your eyes tested. But so some people it's every year, for some people it's every 2 years. As I said, and the optician, you do have to train you have to do a degree for 3 years to train to be an optician, and then you have to do a year in working in practice and pass lots of exams. So we are highly qualified people. And as part of the training, we're trained to pick up any signs of eye disease. I'm going to talk a little about what eye diseases are very common later on in this talk, because unfortunately eye diseases do become more common with age, and with all of us are living longer. So the longer you live, the more likely it is that you'll have an eye disease. You can also pick up some general health conditions for having a sight test, because one of the things we do as part of the sight test is to look into your eye, and this is the only place in the whole body that you can see the blood vessels directly. So when I look into your eye, I can see your veins and your arteries, and that's nowhere else you can see that. So I can if you've got a high blood pressure, then the veins change in appearance, so you can pick that up. If you're diabetic, unfortunately, you're not everybody, but you're quite likely if you've been diabetic for more than 10 years, you're quite likely to have eye changes. So sometimes this is the first way that diabetes is picked up. If you haven't had many other symptoms, it might be your optician who notices the changes in your eye. Ideally, you'd go to see your practice nurse, and if you had symptoms of diabetes, it'd be picked up earlier. But unfortunately, not everybody does that. Some people even have never noticed they've had a mini stroke, and we can pick that up because you often lose the part of your vision. I'll talk about the visual field later on, but you can lose part of that. So, and another important part of the eye test is advising you about your eye health, because there are things that you can do to try and keep your eyes healthy, and we'll talk about that later. And we can also inform you about new products and services. There are plenty of services available in all areas, and Sunderland as well, for people who are struggling with their vision or for various reasons. And if you don't know about these things, then you can't get the help that you need. So I think it is. So I hope I've convinced you to not to slack on your eye tests. Next slide, please. Right. So I wanted to talk a little bit about having a sight test if you've got a learning disability or dementia, because I know some people have said, well, can I bring my husband? He's got dementia. He wouldn't be able to do it. Well, anyone can do a sight test, because we adapt the sight test to your needs. So what we'll do is assess the things that you can do. But I wanted to talk about this because in order to give you, if you or a relative has got a learning disability or dementia, it's very helpful for us if we can know in advance, what your special needs are. For instance, if you've got mobility issues or a large wheelchair, I quite like to rearrange the furniture in my room a little bit, so I'd like to know about that. So some of you, if you're going to the same optician year after year and they know you, then this doesn't apply to you. But if you're making an appointment in a new place, rather than, it's when you make the appointment, it would be very helpful if you could give as much information about yourself or the person that you're bringing, so that we can make the adjustments that are needed, and also sometimes allow extra time for the appointment, because sometimes we'd like to take a bit extra time to explain things or to reassure people, or to give people time. So sometimes if we don't know, and if you make the appointment online and you're just given a half-hour slot and you turn up 5 minutes before, it's very difficult for us to give you the sight test and do all the tests that you need. Obviously with carers, it's very helpful if carers or relatives come with people, and even in COVID, that's allowed if they're needed, and it can help with communication. And if something for some people, the sight test can be very stressful. They don't like some things, like some people don't like having someone very close to them. Some people don't like being touched. Some people don't like bright lights. And it's very helpful if you tell us this beforehand, so we can try and avoid doing these things, because we don't want to make it a stressful experience for you. So that's very helpful. If we can go on to the next slide, please. So again, these are all suggestions, and it's by no means compulsory for you to do any of these things. They're just suggestions to try and help us to make the sight test as tailored to your needs as possible. So some people do find going to have their eyes tested quite scary. Particularly young children do that as well, and some people with dementia. So you're very welcome if you want to visit the sight test the premises, just pop in and just have a look at the room and the waiting area and meet the person that's doing the site test. I'm sure most practices would be very happy to accommodate you if you wanted to do this. Again, it's not always possible, and that's fine. I don't know, is anybody here involved in or familiar with seeability? Just nod your head if you have heard of seeability.
Andy, I get the feeling seeability was mentioned at one of your meetings.
It was. Can you hear me okay?
Yes.
So my internet is all over the place at the moment, but it's really interesting that that was shared, because one of our members recently shared with Wendy how he visits Specsavers, which is obviously a generic service for lots of people, and he has difficulty kind of keeping his head still when he has an examination, and the recent this person and the family carer have been twice recently where they've been unable to perform an eye test because of that reason. So I have looked at seeability, and they do offer that service. But I was just really interested in your comments about, just that, people's personal needs.
Yeah,
yes, I love it. I mean, some high street optometrists aren't very happy about seeing some types of people because they don't have all the equipment, but I think most are, and you don't really have to have any special qualification. There is a online extra learning you could do, as an optician, to see people with learning disabilities, and there are some schemes set up, but certainly I've done lots of site tests on people with learning difficulties, just in under the normal NHS GOS test, and I think obviously I can't comment on the individual case because I don't know the individual, but for most people, I think not being able to keep your head still, it makes it difficult, but there are still things you can do. But I was going to say that the seeability have produced this form telling the optometrist about me, and I absolutely love it if people fill that in and bring it in. It's really, really good form, and if they fill it in with their carer before they come, and I'd always have a read through it, and it's just so helpful. So if you know anybody with a learning disability, and you are bringing them, you can download them off the internet, but they really are just, really helpful for you, and they're helpful for the optician as well.
So I've just put the link in the chat for everyone, if that's useful.
Well, that's great, thank you. I mean, and I know not everyone has a health action plan or communication passport, but again, if you have one, it's worth bringing it to any medical appointment you go to, really. But as far as I'm concerned, I want you to bring it to your site test.
And don't worry if you can't write that link down now, everyone. I'll send it out maybe tomorrow, just with an email with the slides and things on as well.
And sometimes, some people do get a bit distressed during the site test, and they find it all too much. And then sometimes you need to just stop and then carry on another time, and that's absolutely fine as well. Everyone's different, and we all need to be able to see. And we know this as opticians, and not everyone. It's not a problem. You should never feel that. I don't think anyone should ever feel that they can't have their eyes tested.
Great. Next slide.
Yes, please. Right, so I'm now going to go on to talk about what eye diseases are common, not because I want to scare you or anything like that, but just to help you, because maybe one day someone might turn around and say, oh, I think you've got this, I'm going to refer you to the hospital, or maybe you might have a relative with it or something like that. So just to talk a little bit about these things. I'm sure you've all heard of glaucoma. it's a disease which affects the fibres in the optic nerve, which are the little things which send the message from the eye to the brain, which helps you see. And they sort of reduce in number with age anyway, but in glaucoma they tend to get damaged faster and they die off faster. And if you lose too many, then it affects your vision. So it's but if it's caught early and treated, then it can be stabilized so that you can keep your vision for the rest of your life. And for most people, if you're under treatment and the treatment starts early enough. So this is another reason to have an eye test early, because the optometrist can spot early glaucoma, or if they're not sure, they can refer you to a specialist at the hospital who will tell you if you've got glaucoma or not. So it is glaucoma affects about 2 in 100 people over the age of 40, but over the age of 80 it affects 1 in 20. So that's quite a lot, and unfortunately quite a lot of people over the age of 80 are walking around with glaucoma and they don't know it, which is a shame, because they could be having treatment which would, you know, help them to keep their vision for the rest of their lives. Because with the life expectancy now being, you know, well into, a lot of people are living well into their 90s, so it's more important than ever, you know, so people can keep their independence and keep their quality of life, that diseases like glaucoma are treated in a timely manner, really. So so I was going to talk about, when you go to the opticians, a lot of times you do a visual field test, and I'm sure a lot of people don't even know what they're doing. They just sit there and do what they're told. Press the button when you see a light. So I thought I'd talk a little bit about this, because, well, glaucoma affects your visual field. So basically, we can see really sharply straight ahead. Right, you're looking at your screen now, and you can probably see that picture of that man quite clearly. But you can also, you probably don't ever use your peripheral vision or notice it, but you can actually see quite a long way up and then down and to the sides. You can't see it clearly, but you could see it was there. So our ancestors in the African plains, if a lion was approaching, they would have noticed something moving and run. So, it's still important to us to have a good visual field, because it affects our navigation. You know, walking in the metro sets, or you probably don't use the metro. What's the shopping centre in Sunderland called? It's
the bridges.
The bridges. You're walking in the bridges. Someone's coming up with a pushchair really fast behind you. You know, if you don't notice it, that can knock you over. So, you know, your visual field, peripheral vision is important, even if you don't notice it. So, so as I said, what they ask you to do is look at a light in the middle and press a button when you see another light. And if you go to the hospital, they'll be asked to do a much more detailed test of this as well, to check your peripheral vision. And I say, unfortunately, I'll show you, glaucoma can give little areas in the visual field that you can't see. And advanced glaucoma can take away nearly all your vision apart from the centre. And then strokes can also take away some of your vision. In fact, other conditions can as well. Those are the main ones. So for a lot of people, when they're doing the visual field test, they don't like it, because it's obviously they're only used to using their sharp vision straight ahead. So they want to move their head to see the lights, and that you mustn't do that, because then we're not measuring your peripheral vision. So it's like you can see here, you can actually see quite a long way without moving your head. We've got quite amazing peripheral vision. I say we can't see details, but we can see movement and we can see shapes, and this is what helps you, you know, go through doors, navigate escalators, that sort of thing. Right, can I get the next slide, please? So this is an example of someone that's lost a bit of their visual field, because in the early stages, you don't notice, which is another thing why, you know, if you sit at home and never go and have an eye test, you might not notice, because if it's just a small area which is lost, the brain makes up the gap, and you just see an image without some of the detail in it. So this is a picture here of a child running across a road, and then someone you can see the black bit at the bottom, someone has lost a bit of the detail of the vision at the bottom there. So they don't notice the child, but they don't know they haven't noticed the child. That's the dangerous thing. So that, and this is why if you do have a disease which can affect your visual field, like glaucoma or a stroke, the DVLA want you to do another field test to prove that you've got enough safe vision to drive, because you wouldn't notice if you didn't have. This is the nasty thing about the visual field. So it's not, and it's dangerous for the people that on the roads with you, not necessarily you. And obviously, if you get advanced visual field loss, then you will notice shadows in your vision and perhaps bits missing, but not until it's quite advanced. So yeah. So just next slide, please. Right, so macular degeneration is another, unfortunately, getting more common condition. And this is completely different from glaucoma, because that affects the central bit of your vision, the bit that looks at fine detail. So this condition, thankfully, you do often notice quite early, because you'll notice, some people notice a smudge in the middle of their vision. Some people notice that they can't read very well. Some people notice that straight lines are a little bit distorted. And thankfully, most macular degeneration is what we call the dry type, because it's just basically what we call wear and tear at the macula. Because I don't know if any of you remember from O-level biology, but those little rods and cones at the macula that see colour and detail, working overtime all your life, they're absolutely amazing what they do, but because of that reason, they're very, very fragile, so they get damaged quite very easily. So, but dry macular degeneration can unfortunately lead to abnormal blood vessels growing under the retina, and which then leak and cause like little bits of water in the back of the eye. We call the film of the eye, like the film of a camera. We call the back of the eye that collects, that collects the light. We call that the retina, and that gets damaged in macular degeneration. But again, this is a condition. If you get wet macular degeneration, then there is treatment for that. But the treatment is only effective if it's given early. So really, this wet macular degeneration has to be picked up, and the treatment has to be given within a couple of months, really, to be effective. And so, because the cells scar, you get scar tissue and dying of the cells very quickly. So if you do notice any of the symptoms that I just talked about, then you really do need to go and have an eye test. It may be you just need new reading glasses, but it may not be. Right, next slide. So there are lots of symptoms of macular degeneration, but this is just one, and this is I was just showing this one for any of you that have relatives with macular degeneration, because they do lose the ability to see fine detail. And so one of the things that they lose is the ability to recognize faces, because to see your eyes and your nose, and that's how we recognize each other. So if you walk past someone in the street with macular degeneration, the chances are they won't recognize you. So do go over and give them a tap on the shoulder if you're not, don't startle them, and say, oh, hello, nice to see you, because they won't see you, and it can be very isolating not to be able to recognize, because often they've got good hearing and they'll recognize your voice, but they won't recognize that, and they'll see your face and your body, but they can't recognize the features to know who you are. So if you're visiting somebody as well, it's always better to introduce yourself and tell your if it's a grandparent, always tell your children to say, hello, it's Lucy, because they can feel really silly, they can't recognize who it is until the person speaks. And I think that's something that a lot of people don't appreciate. Right, next slide, please. Right, wood cataracts. This is the third fairly common eye disease in old age. Thankfully, this is very easily treated, and we've got that lovely new eye hospital. So we don't need to worry about this one because this is very easily treated, and there's no harm in waiting for a cataract operation. You know, as long as you don't wait years and years so it starts to leak, then that's fine. So cataract, so we've all got a little lens inside our eye. Our eye is very much like a camera, you know, you've got a front bit, a little lens, and then a film at the back. And the lens in your eye gets cloudy as you get older. In fact, everyone over the age of about 50 has got a little bit of cataract because it starts getting cloudy, you know, quite early on, more and more cloudy. And then when it gets to the point where you feel like you're looking out of a bathroom window and you can't keep your glasses clean, it's time to have the lens taken out and they put an artificial one in, which is a very straightforward, low-risk operation. And I think we're very lucky to have a good eye hospital in Sunderland, so that shouldn't be a problem for you.
Sorry, I'm just trying. There you go.
So I think I've kind of talked about this already, but early detection of eye diseases can prevent irreversible visual loss. Other than cataracts, and I've only talked about macular degeneration and glaucoma, but there are lots of eye diseases which, if they're not treated in a timely manner, you know, can make you go blind or at least lose vision. And it's just difficult for at the hospital for them to treat you when you've had a condition for a long time as well. And they've done some research into, and they found that not having updated spectacles is still one of the two major causes of poor vision in this country. And I think I mentioned before that if your vision gets worse gradually, you might not know that you're not seeing very well. And so, and I think, and visual impairment, not seeing well clearly, not seeing details clearly, and missing bits in your peripheral vision or your visual field, there's a definite association between that and falling and hip fractures. So that's, you know, another reason why it is quite important, you know, to keep your vision as best as you can. Right, next slide, please. Yeah, this was a report came out last year, actually. It was done by the College of Optometrists, is like the professional body which overlooks optometrists. When I knew I was giving this talk, I read it again because it's very interesting. It's endorsed by Age UK and the Royal College of GPs and the British Geriatric Society. And I'm going to talk about, they made it was called The Importance of Vision in Preventing Falls. And they made another, obviously I've just summarised it for you because it's a very long report and I read it it was very interesting actually, but I've just summarised the main points for you. So the first point was that all older people should be encouraged to have regular eye examinations, and because not only because older people are more likely to fall. I mean, everyone should have regular eye examinations, but this was just about preventing falling. So next slide, please. Right. So when older people have impaired vision, the measures should be taken to optimise the visual environment. So remove physical hazards and reduce other risk factors. So what that means in layman's term is that when someone has got problems with their vision, they need to try and make the place they're living as safe as possible. So that means good lighting. It means, you know, rails when there are steps, not trying to encourage family members not to leave things that could be tripped over. I know that's really, well, having had young children myself, this is quite a hard thing, not to make sure there's no toys, you know, scooters left in the way. So that, I think the environment is important in preventing falls when someone knows they've got poor vision, because those are things that they won't see that they might trip over. I mean, it's common sense, but you know, until someone's had a fall, you often don't think about it. And this was another thing. There was some research has shown there's a small relation between having new glasses and having falls, and this seems to contradict what I've said about the better your eyesight, you know, the less likely you are to fall. So they looked into this, and I'm going to explain this. So what it seems from all the research they've done is that obviously when it's your brain's involved in seeing as well as your eyes, and the older you get, the more difficult it is to adapt for your body to make changes. So if you suddenly get new glasses and they're quite different to the old ones, then sometimes that it can be quite difficult for your brain to see through the new glasses for a while, or just to adapt to the glasses, and it might make things like judging distances can take a while to get back again. It can take up to 4 weeks to, you know, and things like speed and just getting used to your new glasses, because things look a bit funny and a bit distorted. This can happen at any age, but again, particularly with older people. So, and they found that some falls were associated with people getting new glasses and then falling because they hadn't adapted to the glasses. So if you get new glasses, you need to wear them in the house and environment you know before going out in them. So, you know, at least a couple of days, you know, wear them to watch TV, and then but then if you've got to go out, you know, you might need to wear your old glasses for a while, and only when you've got used to your new glasses and you're happy with them, then, you know, if you are at risk of falling, then you can go out in your new glasses. This only applies again to all this is about people who are at risk of falling. It doesn't apply to everybody, but everybody, again, when you get new glasses, it's probably a good idea for everyone to just adapt to them. I always say you shouldn't drive in new glasses until you've worn them around the house a little bit, because I say you know, everything has to get used to the new lenses. And then another thing is, I don't know how many of you wear varifocals or bifocals, because there was a small relation between bifocals and varifocals and people falling. And I think bifocals and varifocals are excellent glasses, because it saves you having to take glasses on and off all the time, and it saves you losing your reading glasses. But there is a bit of a problem with them, because if you look down sometimes in your bifocals and you're standing up, then things aren't very clear. So because they're designed that if you look down to read, it's clear. But if you're looking down, for instance, if you're going up and down stairs or on escalators or even on the curb, that can be a bit difficult. So the advice from this report was that if you know you're at risk of falling and you normally wear bifocals or varifocals, then if you're going out and there's somewhere unfamiliar, perhaps if you're going on holiday or going to visit somebody, then it would be a good idea to have a pair of single vision distance glasses just to wear outdoors in unfamiliar places, again, just to reduce your risk of falling. So that was a very interesting report. I don't know if anyone wants to, before we take questions, anyone wants to comment on, if anyone's had a fall or had a relative with a fall that wants to comment on any of that report first. I think you're muted, Hazel, sorry.
Okay, thank you very much. Can you hear me now?
Yes.
My husband, he has quite a few falls, and he was wearing varifocals for the last few years, which he really likes using, because obviously he doesn't need to change, as you were saying, for ordinary glasses. So they recommended when he went to the opticians to not wear varifocals at all. So they actually prescribed just an ordinary pair of distant glasses. But unfortunately, although he does wear them, he gets frustrated, because when he's back in the house and he wants to read, then he's still getting, and because of his dementia, he doesn't realize that he's got to take those glasses off and put the other ones on. So I think at the time, the optician should have said to me, you know, only wear the varifocal glasses in the house when he's reading or watching the television, but make sure he has his distant ones when he goes out. I just never even thought about that. And I think that's a good point, a very good point.
Yes, I can't make a comment about the individual case of your husband, you know, because I haven't tested his eyes. But I think originally when the report, they did a lot of research about this, and when it first came out, there was a lot of sort of, oh, you know, bifocals and varifocals aren't very good. There was a lot of sort of backlash, but now, like I say, they are excellent glasses because they like imitate your natural vision, that you look down and you can read. And there seems to be, the problem seems to be only when people are outdoors in unfamiliar places. So if you're at home, I don't think that anyone's saying they're not safe to wear around the house at all, or even if you're going to a club that you always go to, or going to church, you know, somewhere where you're familiar. I think that people tend to fall, you know, often because they're in unfamiliar places more, or out, you know, not in the house. A lot of falls are in the house, but those ones aren't necessarily to do with, I mean, obviously not all falls are to do with vision anyway, but falls in the house is less likely to be.
But I think
it's worth having a chat, Hazel, with the optician.
Yes, I think I will, because if he'd mentioned that to me, I would have actually just left him using the bifocal, sorry, not the varifocals from reading and watching the television. Then he wouldn't get as upset. And then when he went outside, I'd make sure he had his distant ones. So, you know, that wasn't mentioned at this particular optician's, but it's worth going back and checking that out. Yeah, thank you very much.
Liz, can we have a time check? We've probably got about 5 minutes just to allow for questions.
Right, I think we've got, that was the end of the presentation anyway, wasn't it? That's the last
It
slide.
is. Right, we'll stop sharing.
Yes.
Right, great. Has anybody got any questions or comments for Liz? Gavin? Gavin's got his hand up first.
You know, when Liz was talking about that test you got where you press the button, follow the stars. You got to press the button. I forget what they call it.
Visual field test, yeah.
Yeah. Well, I've had that done, Liz.
How did you find it, Gavin?
But I couldn't follow the things. I got a few things, but I couldn't follow them all.
That's fine. I mean, a lot of people really struggle with that test. It's it isn't an easy test to do, and that's, I say, it's fine. It's not, you know, there are other ways of looking at testing for that. So don't worry about it. You know, if you don't. And I think it's if you can't do it, again, it's best to say, you know, I've tried that field test before and I can't do it, and then they won't put you through trying to do it again.
Right.
I think, Gavin, if I remember correctly, your optician knows you quite well. Is that right?
Yeah.
I remember you saying that. Okay. Right, June.
Just about the varifocals, because I went through a phase which hopefully doesn't happen as often as it used to. And I was advised by the optician, by the Falls Clinic, to stop wearing varifocals and to get distance glasses and close glasses. And I had to give up wearing them because I think it's partly because I'm so used to looking down through the varifocal lenses, and my close sight isn't that bad. I mean, the reason I had to get the varifocals in the first place was because I couldn't read with my glasses on. So it wasn't a case of my close sight is totally stuffed. My close sight is fairly good. So I don't think the lenses at the bottom of the glasses are very strong. So maybe that's not the best example. But I found I couldn't cope with the straightforward distance lenses. And I've gone back to using the varifocals. And I'm much happier with that. But, you know, I know these people are giving advice to help people, but it doesn't always work for everybody.
Yeah.
Good point. Yes. I mean, sometimes, that's why sometimes you might get new glasses and they don't, you can't adapt them, or they're giving you problems. And I think, you know, in that case, you can take the glasses back, like as you obviously did, and have a chat with the optician. Yeah.
No, I didn't. I just started using the old ones, I'll be honest. Because I really couldn't, like I say, I was having more trouble with the single lens glasses than I've ever had with varifocals.
Yeah, so I can't comment on any sort of individual
No,
eye
no,
problem
no.
without looking at your eyes or seeing what your prescription is. I can only make general comments today, but I'm sure your optician can advise you next time you go. If you mention the problems you've had, then they can perhaps have a look into that and see why. Yeah.
No, I just want varifocals the next time.
Great.
Can I,
Audrey
can I-
Hodgson, chomping at the bit. Come on then.
can I say I agree with June? That exactly the same happened to me. I went to my opticians. I thought I'll try the distance one, and like June, my reading isn't too bad at all. I can read without my glasses on.
Mhm.
And I put the distance ones on, and I couldn't see very well at all, and I felt really unsafe. And I went back to the opticians and said, well, we told you wouldn't be able to see very well, sort of short distances away. And I thought, what a waste. And I changed them. I wasted money. I think it costed me £130, and I had to get new varifocals. It just didn't work.
Right. Anybody got any more questions for Liz? Tom?
This will be very informative, by the way.
Oh, thank you.
You said you don't do specifics. Well, okay, generally, if a person's got a lot of debris in the last year or so, are they just dirty swines? or are they not washing eyes enough? I've got another question, by the way. Wait, Liz. You sound very unfamiliar with Sunderland. If you're,
I am, yes.
we list you with your temporary passports. There's a good thing going in Roker Park soon. All colours and lights. Do you want a temporary passport, Liz?
Thank you. I'm sure it's a very I do know it a little bit. But I'm sure it's a very nice place.
Sorry, Liz, sorry.
So Liz, I suppose that was quite a good question. So as you get older, do you think you get more sort of debris in the corners of your eyes, or is that just because, you know, you might have been outside more, or, you know, is there any particular reasons?
There is a condition called blepharitis when you get inflammation along the lid margins, and they get inflamed and crusted, and some of the glands get blocked, and this can cause, especially when you wake up in the morning, some crusting, which obviously you need to remove very carefully, otherwise the condition just gets worse. So, and I think another thing when you get older is that unfortunately your tear film deteriorates. It's not as thick, and it loses some of the nutrients. So again, it's your tear film. One of the roles is to sort of cleanse your eye and remove sort of dust and debris, and that isn't it. So yes. But so I think it is important that you do, when you're cleaning your eye, make sure that you're using something clean, and either sort of water that is boiled and cooled, or because you can introduce eye infection as well, quite easily. But yeah, so I think again, there's an awful lot of treatment for that. It's just trying to keep the lids clean from crusting and that sort of thing. Yeah.
Okay, thanks for that, Liz. Right, anybody got any more questions for Liz before we, well, I've got a message from our Anna who had to leave about 4ish. Okie doke. So, just so we can monitor how we work in Healthwatch, we just want to find out a little bit about how you felt about today's event. So she's saying that I'll be sending out an email. I'll be sending one out tomorrow to you all with the links and things on. But in addition, later on, when we've developed something, because this is quite new, we're going to be sending out a little evaluation just so we know what you thought about today's event, if there's anything you feel we could have improved on. And that's a normal thing for services to do. So just to make you aware of that. Now, in addition to that, in Best Sunderland People First traditions, is it okay if I take a screenshot photograph of you just for our records? And
I haven't got my best dress on.
Oh, if you don't want the photograph taken, please just turn your camera off. All right, it's a simple way of getting around that. But I will be using it maybe in our newsletter, but also on our social media. So I'll give you 10 seconds to do your hair.
Oh, I'm kidding. I'm
And
too
put
old to
on-
worry about what I look like now.
To put on your best smile, and I shall count to 3, and I'll do that now. So 1, 2, 3. There you go. Lovely. Thank you so much.
Can I just say, I noticed Anna vanished before the picture.
And it always vanishes before a picture.
She went
Always.
much earlier though.
Always.
She might be like Andy.
I know.
Like
Liz-
photograph cheating.
Liz, Hazel and Audrey, you won't know this, but some people in Sunderland think that there's only me works for Health Watch Sunderland, because I'm on all the photographs, all the videos, because everybody else scatters when it comes to doing anything.
You know what's even
So,
worse? He's making all of us have photographs as well.
yes, indeed,
Yes.
indeed. So
Only
I'm
important
sure you
stuff,
will all join us in saying thank you so much to Liz.
Yeah,
for
very
her
good.
presentation.
Thank you, Liz.
Liz,
Very
it was really
informative.
interesting.
Yes.
Thank
I will send out the recording of it when I can work out how to do that. Just for people who may want to watch it again, find out little points. I'll send you
Well,
some
I'm
of
just
it as well,
getting a
Liz.
new camera where I need to put on now.
Oh,
well, I-
fabulous.
I've
Well
just,
done,
it just
Audrey.
came this afternoon, too late to do it, but it'll be better next
Oh,
time.
never mind. So look out on our newsletters and on our social media pages, because when we do our next campaign, we'll be having a little event as well. So that'll be on there. It's been lovely seeing you all. Thank you
Yes.
all for joining us.
Thank you.
Hi, everybody.
Thank you.
Hi,
Hazel,
everybody.
Hazel, I haven't got your email address, but I'll send it through Angela at Essence.
Yes,
Oh.
that's
Ah.
fine. Yes.
Okay. Thanks, everybody, and goodbye.
Bye, everybody.
Bye.
Bye.
Bye,
Bye.
everyone.
Bye.
Bye.
Thank you. Thank you. Bye-bye.
Bye-bye.
Bye.